Imagine someone dealing with severe depression who also drinks heavily to cope. When they finally ask for help, we often waste time arguing over which problem started first, a frustrating debate over which caused which, the chicken or the egg. The medical system historically splits these two struggles apart. If you try to get help, you're often told to go to an addiction clinic and get completely sober first, and only then are you allowed to receive treatment for your depression. But take a look at this diagram. Almost half of all people seeking help in mental health services also struggle with problematic substance use. When someone lives in that overlapping middle section, clinicians call it a dual diagnosis. Treating depression and drinking as two separate competing problems guarantees failure. They aren't separate. They exist as one connected ecosystem inside a single person. To actually help someone in this situation, we have to stop guessing which problems started first, and instead look at how the two conditions actively interact. Sometimes a substance directly creates the mental health symptoms. For example, using high-potency cannabis can directly trigger intense, frightening suspicion and anxiety. Other times, they share the exact same root cause. A person might develop both a mental illness and a substance habit as a reaction to early childhood trauma or the stress of severe poverty. But if you want to understand the most common pattern, visualize it like this downward spiral. The mental illness and the substance use actively feed off each other, accelerating in a continuous loop where each makes the other worse. This cycle is a predictable response to distress. A person reaches for a tool that offers temporary relief, but over time, that same tool tightens into a trap. People don't stay stuck in this loop because they lack willpower. They stay stuck because the substance is actually performing a highly necessary function for them. Think of it as the hidden job. A substance is often just a logical, albeit harmful, tool used to solve a specific psychological problem. Take alcohol. Someone drinking heavily every night isn't necessarily failing at self-control. They might have discovered that alcohol is the only tool they have that successfully turns down the volume on their severe, unbearable anxiety. Or consider stimulants. A person with undiagnosed ADHD or severe depression might use street drugs just to access the basic energy and focus they need to get through the day. Realizing this leads to a simple but powerful shift. Instead of demanding they quit completely right away, the first thing a doctor or a loved one should ask is, "What is this substance doing for you?" That single question replaces moral judgment with curiosity. It treats the person as the expert on their own life. If a substance is doing a necessary job, taking it away without providing a new way to cope is destined to fail. Recovery means building new, healthy ways to manage, so those old habits aren't the only option. This is where harm reduction comes in. It means keeping someone safe, like offering life-saving overdose medications like naloxone, or giving safer use advice, and staying engaged in their care even if they aren't ready to stop using yet. In modern healthcare, this approach is driven by a principle called no wrong door. As you can see in this flowchart, it means that whether a person walks into an emergency room, a mental health clinic, or a primary care office, that specific service takes responsibility for their whole picture. Practically, clinics must stop bouncing people away to other departments. They don't discharge someone for struggling with addiction, and they never demand a patient be completely clean before offering them help. We have to stop letting substance use be a reason to ignore someone's mental illness. Instead, we can choose to stay curious about the pain they're trying to solve.